You woke up with ringing in your ears. Maybe it started after a concert, a loud day on the job, or a hunting trip. Maybe it showed up one night with no reason at all, and now you're lying in bed in the quiet. It's now the worst part of the day. You can't stop checking your tinnitus. Is it quieter? Louder? Will it be there tomorrow? Is it temporary? Or is this your life now? That uncertainty is often harder than the tinnitus sound itself, and I want you to know that reaction is completely normal. I see it all the time. People who can tolerate the ringing just fine during a busy day, but lie awake at night wondering if they've permanently changed something in their ears. So let me answer the question directly. Can tinnitus go away on its own? Sometimes, yes, especially early on, but timing matters. What you do in the first few weeks and months can genuinely influence which direction this goes. And if you're already past that early window, that does not mean you're out of options.
If you're navigating hearing loss or struggling with ringing in your ears, then you've come to the right place. The All Ears Hearing and Tinnitus podcast is your go-to source for expert insights, real stories, and cutting-edge solutions in hearing health. We'll dive into the latest advancements in hearing healthcare, explore groundbreaking treatments for tinnitus, and offer practical tips for better hearing. Here to help you tune into a world of better hearing, here's your host from Timpanogos Hearing and Tinnitus, Dr. Layne Garrett.
I'm Dr. Layne Garrett, founder of Timpanogos Hearing and Tinnitus here in Utah, and I have been treating tinnitus patients for over 20 years. When people first report tinnitus to their doctor, they're usually told one of two things. Give it time, it might go away, which is true in some cases, or they hear, just learn to live with it, which is sometimes appropriate, but also can be the worst thing that you can tell somebody with tinnitus when it's first starting, because it assumes that the tinnitus is going to be chronic, and it isn't always that way. Neither answer explains what's going on in your auditory system or what the window for natural resolution really looks like. That's what this video is for today. Tinnitus is classified by duration. Acute means less than 3 months. Subacute means 3 to 6 months, and chronic is anything beyond 6 months. And that distinction matters because the biology in those different time frames is completely different. In the acute phase, especially the first few weeks, the auditory system is still in recovery mode. If your tinnitus started after a loud event, the little nerve endings in your ears took a hit. Some experienced what's called a temporary threshold shift. They were overstimulated but not permanently destroyed. During this period, the ringing often is genuinely temporary. The auditory system quiets down as those little nerve endings recover. A study published in Otology and Neuromodulation followed patients with acute tinnitus connected to sudden hearing loss and found complete resolution in about 2/3 of the patients after 3 months, but in a specific group with mild to moderate hearing loss. That does not mean that every case of new tinnitus has those odds. What it means is that the cause, the severity, and the hearing test results all matter. For people with more established tinnitus, the picture shifts. Research tracking people over 5 years found 80% still had tinnitus at follow-up. About 20% saw some improvement, and complete spontaneous resolution was uncommon once the tinnitus had been present for a while. So, give it time contains some truth, but it's incomplete advice without understanding what you're actually dealing with. Now, let me explain why tinnitus sometimes stops being an ear problem and becomes a brain problem. Most people don't know this about tinnitus. After a certain point, the sound isn't really coming from the ear anymore. When the cochlea takes on damage or even just sends reduced input to the brain, the central auditory system notices that, and your brain is wired to maintain a certain level of incoming sound. When that input drops, it compensates by turning up its own internal sensitivity. Think of it like a thermostat that keeps cranking up the heat because it's not getting a signal that the room is warm enough. In the short term, this is the brain trying to adapt, and that's not inherently bad. The problem is what happens when that compensatory state doesn't resolve and instead becomes fixed. The brain can start treating the tinnitus sound like it belongs there, locking in an amplified hyperactive pattern as the new normal. Neural circuits that used to suppress background signals start to fail, and what began as a peripheral ear symptom becomes a reinforced brain pattern. In the acute phase, tinnitus is a symptom of the ear. In the chronic phase, it's increasingly a property of the brain. This is why the 6-month mark matters clinically, though I want to be careful here because this is where sometimes people will hear the wrong message. After 6 months, spontaneous, full resolution of tinnitus becomes much less common. But that's not the same thing as saying that chronic tinnitus is untreatable or that improvement stops. Habituation, Meaningful reduction in tinnitus distress and dramatically different quality of life are still very achievable. Earlier is better, later is not hopeless. If your tinnitus started recently, within the past 3 months, here's what actually matters right now. First, protect your ears from genuinely loud sounds, concerts, firearms, power tools, anything that leaves your ears feeling full or ringing worse afterwards. But this does not mean living in silence or wearing earplugs all day in normal places. That can make the auditory system more reactive. The goal is smart protection from damaging sound while keeping your brain connected to normal everyday noise. Second, get a baseline hearing test, even if you think your hearing is fine. Hearing loss is one of the strongest predictors of whether tinnitus persists or resolves, and you can't assess that without proper testing. Third, pay attention to sleep and anxiety early on. Research consistently shows that sleep disruption and anxiety during the acute phase are among the strongest predictors of which patients will develop chronic distressing tinnitus. That's not blaming anyone for their reaction. It's recognizing that the fear response to tinnitus feeds back into the auditory system and influences whether the brain locks in on that pattern or lets it go. Addressing the psychological piece early does matter. Fourth, and I mean this genuinely, stop reading horror stories online at midnight. I tell patients this all the time. Hypervigilance towards the sound, catastrophic thinking about the future, constantly testing whether the tinnitus has gotten louder, all of that increases the threat response in the brain and makes chronification much more likely. You're not crazy for doing it, almost everyone does, but it does work against you. I've had patients come in after just 2 weeks of tinnitus who are more distressed by the uncertainty than the sound itself. They'll say, I just can't handle it. I just can't handle the thought that this might be my life forever. And that fear is real and valid. It's also something that can be addressed, and addressing it early is part of treatment, not separate from it. Now, if you're already past that early window, here's what I want you to hear clearly. Chronic tinnitus is not a dead end. We don't have a cure. I'm not going to tell you that we do, but we have treatments that produce meaningful, measurable reductions in severity and distress. And the key word is meaningful, not slightly less annoying on good days. Genuinely different quality of life. Chronic tinnitus treatment isn't about chasing silence. It's about reducing the brain's threat response to the tinnitus itself, and where possible, restoring the auditory input the brain has been compensating for all along. Cognitive behavioral therapy, adapted specifically for tinnitus, has the strongest evidence base of any treatment that we have. It doesn't change the sound, it changes the brain's relationship to the sound. And that turns out to be what actually determines whether tinnitus runs your life or fades off into the background. Sound therapy and tinnitus retraining therapy work by gradually reducing the auditory system's alarm response to the tinnitus. And for appropriate candidates, Layne's bimodal neuromodulation, which was approved by the FDA to treat tinnitus, may be part of the treatment plan as well. It's not a fit for every patient, and it's not a reset button, but for the right person, it can be a meaningful part of a comprehensive approach to treatment. For patients with both tinnitus and hearing loss, properly fitted hearing aids address the central gain problem directly, giving the brain the auditory input it's been turning up on its own. Now, here's something I want to address directly because it matters. Not everyone who calls themselves a tinnitus specialist actually has advanced training in tinnitus management. Tinnitus is a specialty within a specialty. When you're looking for care, looking for audiologists who hold the certificate holder in tinnitus management, the CHTM, from the American Board of Audiology. That credential requires rigorous training beyond standard audiology. Organizations like the American Tinnitus Association and programs like Modern Tinnitus are also legitimate resources for finding evidence-based care and understanding what current treatment actually looks like. If a clinic can't tell you about their tinnitus-specific training or treatment approach, that's worth noting. So, can tinnitus go away on its own? Yes, with real probability if you're in the early window, and if the underlying cause was temporary or mild, and if you're not adding new damage on top of it. After 6 months, spontaneous full resolution is less common, but chronic doesn't mean untreatable. It means the goal shifts from resolving the tinnitus to reducing its grip on your attention, your sleep, and your life, and that goal is definitely reachable. Don't assume passive waiting is the same thing as recovering, and don't assume that time running out on spontaneous resolution means your options have run out. Now I want to hear from you. How long have you had tinnitus? Is it new, or has it been around a while? For deeper resources on everything I've mentioned in this video, like cognitive behavioral therapy for tinnitus, sound therapy, Layne, what a proper evaluation should include, our free learning center has detailed breakdowns on all of those things. No email required, and the link is in the description. And if you're here in Northern Utah, we offer full hearing and tinnitus evaluations in our clinics along the Wasatch Front.